hopefully still be able to share all this wonderful information with everybody, all of our cab members and all of our PRP members and future members throughout the Detroit and Flint areas. Uh, Anyways, good morning. Thank you for joining us today for our Lunch and Learn on cancer awareness. So my name is Sean Nurick, and I'm a research assistant with the Healthier Black Elders Center in Flint. I'd like to give a brief introduction of the Healthier Black Elders Center before we get started with our presentations. HBEC is funded by the National Institutes of Health and has been continuously funded for over 20 years now. Many years ago, the National Institutes of Health put out a call for action to increase the participation of minorities in research and the amount of minority scientists conducting research on minority populations. This created various centers across the country that focus on a particular population. Here in Michigan, it created the Michigan Center for Urban African American Aging Research, or what we call McGuire. McGuire is run jointly by Wayne State University, Michigan State University, and the University of Michigan. The Healthier Black Elders Center is the community core of McGuire. And I'd like to show a really brief video that gets into this a little bit quicker that we put together in conjunction with our Flint and Detroit cabs. So, all right.
Did you know research studies bring about discoveries that can improve health and quality of life? And people of all backgrounds need to be included so that communities can trust and see themselves in the findings. Unfortunately, Black older adults in particular are not often invited to participate in research. We understand that people are mistrustful of research because of the abusive legacy of the Tuskegee study and the use of cells from Henrietta Lacks, among other examples. We're here to share with you that there are several safeguards in place to protect the health, safety, and privacy of participants, including older adults. All studies must be reviewed by a panel of experts at a university called an Institutional Review Board, or IRB. Then, studies that want to work with community members here in Flint can go through additional layers of review by non-medical community advisory boards to make sure they are moral, ethical, and confidential, that they obtain consent and provide clear information on the purpose of the study. Our Healthier Black Elders program in Flint and Detroit helps connect Black older adults with research studies approved by both the University Institutional Review and a community advisory board of Black older adults and aging agency leaders. Some of these approved studies provide compensation to participate. Each one differs, and researchers can tell you more about what their study offers when you sign up. We provide free programming on health and well-being hosted at local senior centers and online with tutorials on how to participate if you can't get there in person. A newsletter featuring community events and community member profiles, research studies and findings, and continuing health education.
Healthier Black Elders need you.
We connect you to research you can trust.
Research development needs you.
If you're interested in learning more about the Healthier Black Elders program in Flint or Detroit, you can visit us online at www.engageus.org.
All right. Hopefully, as that video showed, HBC is a wonderful program that aims to address and reduce these health disparities that we've been able to identify through both research and education. We host a number of these health-related educational events to the community throughout the year, both virtually and in person. And our focus is on populations that are aging. So we provide education on topics that range from diabetes to heart health, food safety, nutrition, creating healthy habits, brain health, anything that is health related or even health adjacent is in play. And we hope that some of the information that will be presented can be very helpful both to you, to your family, to your loved ones, and to your peer groups. So although we typically hold these events in person, we hope you enjoy and have been able to enjoy this virtual format. We're going to be transitioning slowly away from this soon, But in the meantime, thank you. Sit back and enjoy. And as a reminder, our Lunch and Learns are being recorded and will be available at the HBEC website. And that website will be shared with you in the chat box during the presentation today. To learn more about our program, feel free to visit our website, which is www.mcguar.org. That's www.mcuaar.org. Or you can call the main office at area code 313-664-2616. Let's say that one more time for everybody. The website is www.mcguar.org, mcuaar.org. And our phone number is 313-664-2616. All right, before the presentations, just want to make a few housekeeping announcements here. Again, this webinar is being recorded, will be available to watch at a later time on the website. For those of you that are on a laptop computer, if you have, or even a tablet or phone, if you have a question for our speaker, you can go ahead and submit those questions either using the Zoom chat or preferably the Q&A box that's located at the bottom of the screen here, bottom of the Zoom window. For those who are joining by telephone, if you have a question that does not get answered by the end of our program, please call the HBEC office and leave a message with your question. One of our staff will follow up with you to try to get that answered. So again, September is National Prostate Cancer Awareness Month. According to the website Zero, the end of prostate cancer, an American man dies from prostate cancer every 15 minutes. That's more than 94 deaths each day, or 34,500 each year, or nearly enough to fill the Cleveland Guardians baseball stadium. African-American men are at a high risk of prostate cancer. Up to 1 in 6 men will be diagnosed with prostate cancer. But another trend, I don't want to stomp too much on our main presenter, Dr. Hyde. He may have some of these similar statistics, but only over 30% of Black men over the age of 50 have been screened for prostate cancer in the past year. But lest we think there are only cancers that are specific to the male population, we remember that there are many cancers, diseases that severely affect the female population. And whereas September is Prostate Cancer Awareness Month, October is National Breast Cancer Awareness Month. And at this time, for our Critical Crossroads segment, I'd like to introduce Ms. Patricia Mullen, who would like to speak about her experience. So, Ms. Mullen, go ahead and
Hello, my name is Pat Mullen. Can you all hear me? Hello?
Yes, we can hear
yes,
you.
you're crystal clear.
Oh, thank you so much. Okay, yes, I'm Pat Mullen. I'm a cancer survivor. I went through that cancer about 14 years ago. At that time, I was 54 years old. And I would like to tell you about my experience, my journey, my fight to live. In the past, I was an X-ray tech and a nuclear medicine technologist. I was familiar with treating cancer patients, and I was dedicated to improving or helping them go through that phase in their life. I didn't know I was going to have to be treated then. And it was a somewhat difficult experience, but I got to tell you, I had what they call the faith of that mustard seed. And I know a lot of you people or guys are familiar with what I'm saying. And it took me through that. I just had my birthday in August, and I'm now 64 years old, and I made it. I got to tell you, I made it. Please listen to your body. That's what I got to say. Your body tells you so many different things, and we need to listen to it. The reason I'm saying that is because actually I felt a sting in my left breast at that time. And the sting just kept on coming and coming, and I didn't know what to do. But then I felt a lump, okay? And at that time, I didn't have any insurance, none. I left the medical field, and I had a licensed adult foster care home. And anyway, I went on with that dream. But I have to tell you, I had picked up a piece of paper That piece of paper gave me the information that saved what I say, my life. It helped me to get my mammogram because it had a number on it. And that phone number was for BCCCP. That was for not only breast cancer, but cervical cancer. I called that number and I signed up. I had a mammogram, which I had did so many times in the past anyway, but this was different. Then they told me I had to have an ultrasound. Then after that, I had to have a biopsy on my breast. And then I was told I needed surgery. Oh my God, that was an awakening. I'm so thankful for BCCCP. It is for women aged 40 to 64 years old. It's totally free. They took me through all that and it was totally free. I had to go to a surgeon after that and she explained to me the procedure. And a date was made for me for that surgery. And I went to a reputable hospital. They gave me excellent care. I did receive chemotherapy because while they did that surgery, they also put a port on my right side where I can receive the chemotherapy. Again, I said this was free. Again, I'm going to say, listen to your body. Again, I'm going to say, don't be afraid, because there's so many people that's afraid to listen or go through with the procedure. And what's the outcome? You could die. I didn't want to die. I wanted to live. And I have to keep on saying about that mustard seed. And you know how small it is. And all you have to have is faith. I'm going to say, I also had reconstructive surgery, and that wasn't easy because it hurt, because then they have to actually manipulate or expand your breast tissues where they can put what I have now. It's a silicone inside of that region in my breast. But all this was worth it. Like I said, it was 14 years ago. Cancer is not a death sentence. It is not a death sentence. Don't be afraid. And thank you for listening to me. I'm Pat Mullen. Thank you. Hello.
All right. Thank you very much, Ms. Mullen. I appreciate you sharing such an intimate story, and thank you and congratulations on keeping up that good fight.
Oh yeah, thank you.
All right. So very briefly, just two more announcements, and then we're going to get into the main part, our keynote presentation for the day here. So briefly, on Sunday, September 25th, we're looking to start at noon for a 1 o'clock kickoff. We are going to do our first Healthier Black Elders-Flint tailgate. So we are going to do this for the Detroit, Minnesota game. So if you're interested, please consider joining us for fellowship and friendship. We're still putting the final wraps on details for the event, but it will be at Hasselpring Senior Center, 1002 West Holm Avenue in Flint, 48505. And for everybody that is here or that is on our PR in the PRP or in our mailing list, you'll receive flyers about this in the upcoming week. And then one other announcement for the good of everybody here. We will have a new additional lunch and learn happening at the end of the month. We're starting to work with some of our friends at the Alzheimer's Association. This will be another virtual lunch and learn, but we would like to eventually be doing these in person soon. So more information will be coming from us with flyers and login information for that event. So keep an eye out in your mailbox, and we will look forward to hopefully seeing you at our future events. All right, so time for the main event here. I'd like to introduce here our guest speaker, Dr. Christian Hyde. Dr. Hyde is a board certified radiation oncologist, and only a small percentage of radiation specialists have completed a fellowship training program in proton therapy. During 2018 and 19, Dr. Hyde subspecialized in proton therapy and related studies at William Beaumont Hospital in Royal Oak. Dr. Hyde has concentrated his practice on promising new technologies like proton therapy to offer his cancer patients the most current treatment options available. Dr. Hyde started practicing at McLaren in 2019. Before coming to McLaren, Dr. Hyde earned his medical degree from the UCLA School of Medicine, where he also completed his 4-year residency in radiation oncology. He practiced with the Huntsman Intermountain Cancer Network in Utah for 6 years, then for 6 years in Atlanta, Georgia, where he helped to launch a brand new cancer-only hospital. Dr. Hyde has specialized interest in proton therapy for complex cancers, reirradiation, and radiosurgery of the brain, lung, and liver. One of the things that drew Dr. Hyde to radiation oncology was its ability to help spare patients from the disfiguring or disabling radical surgeries that are commonly used to remove the breast, the prostate, and the voice box. He works as a tireless partner with other physicians, including surgeons and medical oncologists, who may prescribe chemotherapy or immunotherapy in combination with radiation therapy. Dr. Hyde is active in clinical research and has enrolled patients in exciting new clinical trials through the Karmanos Cancer Network. Dr. Hyde is dedicated to patient-centered care and is proud to be a McLaren Proton Therapy Center and the larger Karmanos Cancer Institute team. So with that, I will stop sharing and I will hand it over to our speaker, Dr. Christian Hyde. Dr. Hyde, welcome.
Thank you. I'm glad to be here.
Great.
I appreciate the introduction. That means I can talk a lot less about myself and talk a lot more about why we're here, which is to help the community of Flint and the surrounding areas to be healthier and to be aware of some new treatment options when it comes to cancer. Like you mentioned, October is Breast Cancer Awareness Month and November is Prostate Cancer Awareness Month. So I want to focus today on the most common cancers for men and women, breast cancer for women and prostate cancer for men. Those are kind of the #1 most common cancers, and we do see a lot of them in our community. Thank you so much to Pat for sharing your story about when you went through breast cancer 14 years ago. And fortunately, you got through it. You're doing fantastic. Even in just the last 14 years, there's been a lot of progress. And one of the things that we now have available that we didn't have in this community 14 years ago is called proton therapy. It's a newer, what I think of as a kinder, gentler type of radiation treatment that's more focused right where we need it to go and does less damage to other parts of the body. I do have a presentation. Sean, is it possible for me to share my screen?
Yep, you should have full accessibility to do so.
Okay, great. Thank you. So I'm just going to pop up this presentation, and you should now be able to see
Perfect.
an image of the McLaren Proton Therapy Center. It's a beautiful new building. Sean, do you see that all right?
Yep.
Okay, great. So this is a picture of our center from the outside, and we're just across the street from, hang on one sec. We're just across the street from the big McLaren hospital that's on Ballinger and Beecher Road. And this is attached to the same cancer clinic, the Karmanos Cancer Institute here in Flint, where patients can receive chemotherapy, they can meet with their surgeons, and they can also have more traditional forms of radiation therapy as well. So thank you for the kind introduction, kind of explaining how I became a Michigander 4 years ago to learn proton therapy specifically. And I'd like to share just some information. I will talk briefly about what is proton therapy for cancer. It's a beam, it's an external treatment. It's totally non-invasive. You don't have any cuts. Most patients don't feel sick. The most common side effect is feeling tired. It can be used as an alternative to X-ray therapy, which has been around for decades, maybe even a century now. We'll talk about which patients benefit from proton therapy, especially the breast and the cancer patients. And I'm going to share a couple of patient stories with you. And we'll talk about some side effects and how proton therapy can help reduce the side effects of radiation therapy. I'd just like to share a video from one of our patients, Marcus, who was treated at our center not long ago. That'll take about 2 minutes.
My name is Marcus Jefferson. I'm a recent patient at McLaren Proton Therapy Center for prostate cancer, and right now I am feeling great. I've been getting annual lab work done for years, and I didn't hear anything from my doctor for a while. And then next thing I know, I was getting a referral to a urologist, and we agreed that I would have a biopsy. And I didn't think anything of it, and I went on about my business. And 2 days later, I went in and we talked and looked around and looked at the traditional therapies, and then I found out about the proton therapy. And when they said this proton therapy actually pinpoints the tumors and it doesn't affect the surrounding organs and tissue, I said, this is wonderful. I've had 44 treatments, and I was back in here back in June, and for the first time in 6 years, my PSA was under 4. So I'm very happy about that. Not only would I recommend proton therapy, but I recommend that we get more publicity out there so that people know that this is an option. Because when I first came, I just thought it was prostate specific. But I met people with breast cancer and esophageal cancer and various cancers. After I got through talking to the people here at the therapy center, I went over to the McLaren Hospitality House, and the staff was friendly. They gave me a tour. There was enough room where my family could come down and stay. And they got 4 kitchens in the lower level, and they got a workout room, and they got a games room. And one of the things that I appreciate about the hospitality house is I could concentrate on my wellness, my fitness, healing, and getting well here.
All right. So one thing that Marcus talked about was that his cancer was detected by a blood test called the PSA, or prostate specific antigen blood test. And for guys who are over the age of 50, it's recommended to get that annually as part of a regular physical. And normal is less than 4. He talked about, his finally got back in the normal range after treatment. Anything above 4 needs to be watched and can sometimes even lead to a prostate biopsy that's usually done by a urologist, just like it was in Marcus's case. And that led to his treatment. He talked about how the treatment is pinpointed. X-rays are really useful for imaging. If you get a chest X-ray, there's an X-ray beam, it goes in the front of you, it comes out the back, and it's able to give us a picture. We can see what's happening inside the chest, but that's not necessarily what you want when there is cancer treatment, because everywhere that X-ray beam goes through, it's doing some damage. It's damaging the cancer, which you need, but you don't want it to be damaging normal cells. You don't want it damaging the heart or the lung. And so that's where proton therapy can be a big benefit, because if the tumor is in front of the lung, the beam will stop inside the tumor and it won't keep going out the other side. So protons are really pretty amazing that way. It's like a laser beam that goes in, but it doesn't go out. It stops inside the tumor where it's supposed to be. And that means that we're doing less damage to the rest of the body, like only 1/3 as much radiation has to be put into the body to do the same job with protons as you would need if you were using X-rays. So we use this very commonly for kids who have tumors, and we're trying to be really careful. Their bodies are small. We don't want to cause long-term damage. And we've been able to use that also for adults. So it's a really amazing machine. The traditional X-ray machine that you see on the left, that's been around for decades, is kind of a big machine. It's not quite the size of a car, but kind of close, and costs about $2 million or $3 million. And the proton machine is even bigger. The proton center is almost as big as a football field, and inside it is this proton accelerator. It takes protons and it swings them around at the speed of almost to the speed of light, and it sends them out, at very high speed, and they go inside the tumor at that high speed, and they hit it like a focused bullet or a BB, and it kills the cancer cells. We are lucky that we have a proton center here in Flint, because most states still don't have one. You can see here that there are now 2 in Michigan. There's one in Flint with McLaren, and there's another one where I trained down in the Detroit area. The typical course, like Marcus said, he had 40 some treatments. That's pretty common for our prostate cancer patients. You come in, you lay down on a table. This ring that's shaped like the letter C, it kind of drops down and it images the prostate, make sure we're exactly on target, just with millimeter precision. And then the treatment is given. Patient gets up off the table, go about their day as usual, no restrictions. The main side effects when we treat the prostate are related to what's next door. So the organs that are next to the prostate's down in the pelvis and is part of sexual function. It makes the fluid that is part of the semen. So the sperm is carried by this fluid from the prostate and comes out during sex. The bladder is on top of the prostate, and some guys will start to have bladder problems. If their prostate is filling up with cancer cells, it can be more difficult to urinate. So if you're having a lot of problem emptying, or you're having to pee like 2 or 3 times a night, that's worth getting checked out by your doctor. The other things that are near the prostate that can cause side effects when we radiate are the bladder and the bowel. Here's the sigmoid colon here outlined in pink. Now with protons, we're able to help stay out of the bladder here in orange. We're able to help stay out of the bowel here in pink. We're able to stay out of the rectum here in brown, much better than if we were using x-rays. Here's x-rays on the left. X-rays are kind of smearing the x-ray dose through the bowel, through the rectum, and into the bladder. So you can see that protons are really much more pinpointed just where it needs to go. We're doing the same job with only 1/3 as much total radiation as if we were using x-rays, because the x-rays kind of slop around where we don't want them to be. And so that really helps. So here's kind of the same thing viewed from the front. On the left, you can see this pelvis with the hip sockets on the sides. So here's the right hip socket, here's the left hip socket, here's the spine. And we're treating the prostate, but we're also treating the lymph nodes. Cancer can sometimes spread from its original organ into the lymph nodes. The lymph nodes are like a filter that can catch bacteria and viruses and cancer cells that start moving away from the place where they started. So sometimes we'll need to radiate the lymph nodes, and the bigger the area we treat, the bigger the advantages to using protons, because now we're normally treating more of the bladder and more of the bowel, but when we use protons, we can stop the beam where we want to, so we're not doing as much damage to the bladder and bowel. And there's kind of what that looks like in cross section. Here with the x-rays, you can see the beam in blue is kind of coming in from everywhere. It's hitting the lymph nodes, which are these areas on the sides of the pelvis next to the hip sockets, but it's also going across the middle. You know, the x-ray beam goes in one side and out the other, and so it's doing damage. You know, it's like hitting the bladder, it's hitting the rectum, it's hitting these things in the middle of the body that you don't want to hit. Whereas protons, they come in and they stop. They don't go through the rectum, they don't go through the bladder. They come in and they stop, and they don't go across the midline. So that's really a fundamental difference and a major improvement over x-ray treatment, because we can tell the beam, go here, not there. Hit the tumor, don't hit the rectum, don't hit the bladder. There's still some overlap because they're touching each other, but not like in the old days with x-ray treatment. And I was amazed. I was talking to one of my patients recently. He said, I went to a support group and I was talking to these other guys, and it was just me and one other guy who had even heard of protons. And so he said, you really got to get the word out, because there's lots of guys out there with prostate cancer, and very few of them are aware of proton therapy. So let's not just talk about men's cancers. Let's also talk about women's cancers. Breast Cancer Awareness Month coming right up in October. We're going to be seeing a lot of pink ribbons. I bet most of us have have heard of, a friend or a family member, someone we love who's been affected by prostate or by both prostate and breast cancer. They're both very common. But let me share Melissa's story, who came to us from across the state. She came from West Michigan, where she lives, to receive proton therapy, because there is no proton therapy except in Detroit and in Flint. Let me go ahead and pull up her story.
Hi, I'm Melissa, and I received treatment at McLaren Proton Therapy for breast cancer. I actually found a lump myself, and I followed up with my doctor, and I was immediately sent over to the hospital for more testing, and which confirmed that I did have breast cancer. It was very terrifying, especially since I had just walked through a 2-year journey with my mom, who also was diagnosed with breast cancer, and she ended up passing away. So for me, it was a very terrifying experience to find out that I had been diagnosed with the same thing that took my mom's life. I actually discovered the proton therapy through a friend of mine. She told me that there were less damage to the body, to the tissues and the organs, and so it was something that I wanted to find out more about. So I ended up calling the McLaren Proton Center and finding out about it and scheduled an appointment to come in to learn more about it. With the left-sided breast cancer, I definitely wanted to miss the heart, and that was something that they could do. There was a lymph node in the chest that they could miss my heart and focus in on that. I drove in at first, and then I found out about the hospitality house, and I decided to stay there. So I stayed several weeks there. Had a wonderful experience there. It's a very clean, very nice place. They can get you anything that you want, and they're very helpful there. And so I had a really wonderful experience staying there. I stayed just during the week, so I would usually come in on Monday and then go home on Friday after treatment was done. Spend the weekend home and then come back again for the next week. The treatments went really well, so everything is looking really good, and I'm doing really well. I've been telling other people about it because of it not going all the way through the body, just with being more precise and with less damage to the body. It's definitely something I recommend to other people.
Okay, so thanks for listening to Melissa's story. One of our professional society leaders in the country is this gentleman, Dr. Anthony Zeitman. He's at Harvard, and they've had proton therapy for a long time, more than 3 decades now. And he shares the story of his sister, Kim. She, at age 22, was diagnosed with a lymphoma, Hodgkin lymphoma. And in the old days, we would give radiation pretty much all over for Hodgkin's lymphoma, from the neck, from like the jaw down to the thighs, just about. And that's what she had. And because of the radiation to her heart, just about 20 years later, at age 39, she had her first heart attack. And she ended up needing not 1, but 2 bypass surgeries. And eventually, unfortunately, she died of another cancer because she received so much radiation when she was younger. 30 years later, that led to pancreatic cancer at age 51. So Dr. Zeitman, when he talks about her, he said, radiation added 30 years to her life because otherwise she would have died in her 20s. But it also took away 30 years of her life, because normally she probably would have lived to her 80s. So he's a big advocate for better radiation and less of it, and so am I. And we've known since at least 2013, almost a decade now, that cardiac radiation or heart radiation can be fatal. So we really need to minimize it. Radiation therapy isn't a health food. There's a limit. There's only a certain amount that the organs can tolerate. And if you go beyond that, then we start to see long-term damage. And this is a picture of a patient that we treated at the Proton Center. And the radiation is going where we want. It's going where the breast would be, over here on the right of the image. And it's not going where we want to avoid, which is the heart. So the heart is here in the middle. It's shaped kind of like a big boot, and it points toward the left side. And you can see the radiation, low dose here in blue. Even the low dose is not going into the heart, but we are able to treat the lymph nodes. You can see a couple of metal clips here in the armpit where some lymph nodes were taken out. And because this patient had lymph node spread, we have to treat the other lymph nodes that are upstream of those cancerous lymph nodes. So we're treating a pretty big area, but not as big as the area that we'd be treating if we were using x-rays. And we have some clinical trials going on that are looking at, how much of the heart can we avoid. This is kind of what it would look like if we were treating with an X-ray beam. X-ray beams travel straight and would go right through the tip of the heart here, radiating about a third of the heart, that you wouldn't have to treat using proton therapy. We can sculpt the proton beam. We can make it curve just like the body is curved. Wherever we want it to go, we can make it go. And this is just another example of another patient we treated with protons. With our best possible X-ray plan, we were still treating about 2/3 of her heart with radiation. And with protons, just a little bit of surface dose to the heart was all that was received. We're also looking at maybe you don't have to treat the whole heart. Patients who don't have lymph node spread, the cancer is more likely to be contained just to the cavity where the cancer was removed. So we're starting to look at short course radiation, 10 daily doses instead of maybe 30 daily doses. So radiation is usually given 5 days a week, Monday through Friday. Each treatment is relatively quick, maybe 30 to 40 minutes. And we try to treat as small an area as possible. And the best radiation is the least radiation, I like to say. So we're looking at treating smaller and smaller areas with shorter and shorter courses of radiation. So I just wanted to summarize that the future is bright for cancer patients. We've come a long way. Even in the last 14 years, we have treatments available now in Flint that weren't even here 5 years ago. And McLaren's been a big supporter of proton therapy, a real pioneer in the area. And we've been able to help a lot of people. More than 600 patients now have been treated at the Proton Center, and more every day. So in summary, proton therapy is a new type of radiation. It's just as curative as X-rays, but treats less of the body, generally about 2/3 less radiation to the body when we're using protons. This means less dose to the heart and the lung when we're treating for breast cancer, and less dose to the bowel and the bladder when we're treating prostate cancer. And that can translate into lower side effects, especially when we're treating big areas of lymph nodes, like, the lymph nodes for breast cancer can even be up in the bottom of the neck. So that's a big area that we want to minimize the side effects from. And that's my message. I wanted to share that I'm not the only one here at the Proton Center. I work as part of a team. There are 3 other doctors here, Dr. Gayar and his son, and my colleague, Dr. Brian Ye, who joined us from New York and is another expert who has fellowship training in proton therapy. We have a nurse navigator that can be reached at this toll-free number. Patients anywhere in the state or even outside of Michigan can call. It's this 855-MY-PROTON, and we're also online at mclaren.org. If there are any questions, you can give us a call, and we can talk to you about whether proton therapy is right for you or someone you love.
Excellent, Dr. Hyde. So we do have one question. By the way, we appreciate the line about radiation therapy not being a health food. I feel like that's the quote of the presentation there. But something actually triggered my interest here. I know in the past, pancreatic cancer has been awfully notorious for such a terrible prognosis. Can you loosely speak to how that has improved prognosis for patients?
Yeah, sure. So we do treat, in fact, in preparing this talk, I was just looking at some slides of patients I've treated with proton therapy for pancreatic cancer. Unfortunately, we are seeing more of it. The number of cases is on the rise as people are living longer. We're seeing more and more pancreatic cancer. And the cure rate, unfortunately, hasn't changed that much. And the reason is, we don't have a good screening tool for pancreatic cancer. For prostate cancer, we have the PSA blood test, but we don't have a early detection test for pancreatic cancer. So the signs for that one are, feeling some pain, maybe some indigestion, and change in the skin. If someone starts to look yellow, they may have a blockage that's causing the bile to build up in their body, and that can be a sign of pancreatic cancer. Unfortunately, about 3/4 of the time, by the time it's detected, it's already spread. I used to love watching Jeopardy. I still do. But Alex Trebek, he died because of pancreatic cancer. And unfortunately, once it is spread, we don't really have a way to get rid of it. but I have been treating some patients where the cancer is still confined to the pancreas. Maybe it's not operable. That means it can't be cut out, but we can still try to kill it in its place. We can give focused radiation. We can hit it with a higher dose than we've been able to do with X-ray therapy. We can give more concentrated treatment when we're using the protons. And I think that's going to make a difference. In fact, that's one of the other clinical trials we're going to be opening in the next few months is for pancreatic cancers.
All right. And actually another question, talk about a specific cancer. How has proton therapy been helpful with the treatment of ovarian cancer?
Okay, great question. Ovarian's another one, unfortunately, where it can be difficult to find it early because, again, we don't have a blood test for ovarian cancer. We don't have a mammograms for ovarian cancer that can pick it up when it's small. So the ovaries, they sit inside the cavity of the pelvis, and the way they spread is little cells will break off from the ovaries and they kind of float through the abdomen. And usually by the time it's found, it's kind of spread throughout the lining of the abdomen into the lymph nodes. That would mean if we were using radiation, we'd have to treat a really big area, basically the whole abdomen, which we used to do. But now that we have drugs that can go everywhere, those are more effective. So usually we don't use proton therapy for ovarian cancer unless maybe it's blocking a major artery or something, if someone's losing blood flow and it's not safe to operate, then we might radiate using protons or another type of radiation. But I wish we could use it for ovarian cancer, but due to the nature of the disease, it's usually more widespread by the time we find it.
Okay. All right. And one more question here. So what advice would you give personally for patients so that they don't have to meet you?
Oh, yeah. So there's kind of three main risk factors that are reversible. We can't control how old we are. Everyone's getting older, and that's great. That's one of the risk factors for cancer that we can't change, but we can age more healthily. And the number one thing to do is quit smoking. If you're a smoker, you got to quit. I help lots of people quit. It's the number one cause of cancer. It's also the number one preventable cause of heart disease and stroke and emphysema and lots of other things that kill us and make us have less quality of life. So if for no other reason than to get more enjoyment out of your life, it's time to quit smoking. Number two is alcohol. Nobody really talks about it, but alcohol is another major risk factor for certain cancers, especially cancers of the mouth, the throat, the esophagus, even breast cancer, because you got to remember the alcohol gets absorbed in the bloodstream. Once it's in the bloodstream, it goes everywhere. And so it has some cancer-causing properties that have shown up as increased risk of breast cancer for women. Another cause of cancer is viruses. We know that cervical cancer, anal cancer, and some tonsil cancers are caused by human papillomavirus, or HPV. There's now an HPV vaccine, usually given to teenagers, because this is a sexually transmitted virus. And if you get the vaccine as a teenager before you're sexually active, you're much less likely to end up getting cervical cancer or one of these other vaccine preventable cancers. So those are kind of the easy prevention steps. And the other ones are a little harder. Things like eat your vegetables, don't eat too much fatty meals, and exercise. It's been shown that exercise helps reduce the risk of heart disease and lung disease, and keeping your blood pressure down helps prevent stroke. The relationship is not as clear-cut for cancer, but I do know that my cancer patients who are exercisers, they come in with fitness, they're able to get through treatment easier. The chemotherapy is not as fatiguing. The radiation is not so difficult. If you're taking good care of yourself, it's going to be an easier battle than if you've neglected your health all along.
Excellent. And that ties with a speaker that we had a few months ago who discussed the importance of prehab before receiving treatment. So excellent. We love how those all come together.
Yeah, thank you for asking about prevention. And the other thing is early detection makes a big difference. The best cancer is no cancer. The next best cancer is a small cancer. So, see your doctor annually. They can talk to you about screening tests, things like colonoscopy every 10 years, starting at 50. If you haven't had one and you're over 50, it's time. Or other ways to screen for colon cancer, like the new Cologuard test that's non-invasive. You just send off a stool sample and they determine whether or not there are some changes that look like colon cancer. Pap smears for cervical cancer. If skin cancer runs in your family, or you've got something that won't go away on your skin, get in to see the dermatologist. Those are some other kind of ways to catch cancer early. Thank you, Sean.
Excellent. Excellent. All right. Well, I think that about does it here for us today. I'm not seeing anything else in the Q&A box or the chat box. So Dr. Hyde, thank you very much for sharing your time and especially increasing the awareness of the Proton Therapy Center. I know I've driven by it a number of times. I was relatively curious, but you know, it's a great, and it's a testament to you and to McLaren for being up here, being in our community, and providing such quality healthcare to all of our residents in the Flint and the Flint area and the entire region. So thank you so much. Thank you for sharing your time. We'll let you get back to all the important things, and I think we'll go ahead and move on. So thank you very much again for being here today.
You're welcome. It's been a pleasure.
Hyde. All right.
Thank you, Sean.
So on that note, we're just about ready to wrap up here. I want to thank everybody again for being here in attendance. The recording will be available again on the McWar website afterwards. In October, we will be hosting our next joint lunch and learn event. And it is going to be featuring a speaker who's going to discuss health literacy for us. So it should be awful interesting, and what we can do as patients to improve our patient-doctor communication, so that can actually help us to improve our overall health. So again, if there's anybody who is not a member of the HBC program and would be interested in joining, we can go ahead and sign you up over the telephone. Feel free to give us a call at the main office, 313-664-2616. When you become a HBC member, you'll receive our biannual newsletter. You'll learn about upcoming research, or current and upcoming research studies, and learn more about future programs like the one we held today. So thanks again to everybody. Please stay safe, and we'll see you next month for the Health Literacy Lunch and Learn on Wednesday, October 19th. Take care, everybody, and thank you for your time today.